KBFI. I'm your host, Bob Witte, and as we have so many times in the last few weeks, we are going back to the phone and back to Bonner General Health, and once again we have Dr. Stacey Good from the ER department with us. Dr. Good, how are you today?
Doing pretty well. Not working, so I'm doing better.
You know, that's one of the questions I was going to ask you. I know you and your husband are both doctors. You've both been on the show. You were both on the show Wednesday. And you have two little boys at home. How do you manage your unbelievably busy work schedule and then two little guys running around the house?
Yeah, it's a daily juggle. We've had great childcare. Fortunately, that hasn't been a source of stress, and we just try to put our shifts kind of on the same days. So those days are more stressful, but then it kind of gives us more days off. But we manage, and that's kind of what we signed up for.
Yeah, I guess you knew exactly what you were getting into, and I know you two, and you're great parents and very well prepared for what life is throwing at you right now. But we talked about it last week about your military training, and let's touch on that again a little more, how both you and your husband haven't really had experience at this, but have been trained to handle something like what this pandemic's bringing at us.
Yeah, actually, so I was part of the Ebola task force. I was actually in my fellowship at the time, and really kind of largely in part with the simulation aspect of it, and when we had troops deploying to the areas that were experiencing a lot of outbreaks, how do we treat them in the ER? How do we don and doff? How do we do imaging and x-rays? So we had a big simulation lab, so I was kind of the one acting as a Ebola doc there. But Ben, like I said, he was part of a chemical warfare unit, and one of the big things he was in charge of was like decontamination, and it was something that he couldn't talk about then, but his unit was involved with the Sochi Olympics because there was some chemical warfare type threats going on there. But so he's currently working on like a decontamination plan for us, because what we're finding out in especially Italy right now is that healthcare workers are getting infected, not when they're taking care of the patients, but when they're taking off their PPE gear. And there's no really great way to do it, but that's when they get infected, is from basically what we call doffing. So donning is putting on the gear, doffing is taking it off. So we're trying to come up with the right protocol for spraying off with bleach, dunking the things that can be dunked in bleach, saving the things that can be saved and what can't be. So that sort of he's been a big part of. And then kind of the last part is I think to be an ER doctor you have to have like a certain amount of keeping your cool, especially when the bad stuff is going on. And I think the military experience has taught us that kind of on a bigger scale, in a bigger environment, and kind of also to lead from the front and not just sit back. So I think those things have been advantageous for us in this situation.
Absolutely, and we're very lucky to have you two, as well as everyone at Bonner General in the ER department, especially in this last few weeks, and most likely in the several coming weeks. How are things in Bonner, Boundary County? Do you have a feel for the number of people who are coming in and getting tested, and have there been any positive tests returned yet?
Still no positives. We have, as of today, done 95?
Oh. Mm-hmm.
Okay, so we have 95 that are still pending results.
No, that we've sent out.
Oh, I'm sorry, I'm getting mixed numbers here. Yeah, so we've tested about 150. We've gotten about 3/4 of those results in. In the big picture, that's
3/4 of them have been negative.
Correct. Yes. So the answer. So I kind of wanted to touch on two things with that. So one, that's not a lot of tests. I mean, New York is testing 70,000, I think, a day. and they're getting the tests. We just aren't getting those tests, which is really frustrating. Two, some of the tests not from the state, but in a lot of private companies are taking up to 10 days to come back. And people are getting really frustrated, and I totally understand that, because we are too. It's totally out of our control. In fact, our lab and people are calling them daily, and they basically said, stop calling us. We'll tell you when your results come in. The second point I want to touch on that is there has been every day there's new papers coming out. And so constantly reading things, but the viral shedding, which is a term that's being used when you get infected, the first few days, so let's say you just have a headache or you have a sore throat, the viral shedding that you're giving off is going to be less. When you start getting more symptoms, you start getting the cough, you're febrile, you're shedding more. So there is a chance that some of these tests could very easily be false negatives, and that they were tested too early, where that viral load was less, and so it didn't get picked up on the swab if you were tested kind of earlier on in your course versus on day 6, 7, 10. That doesn't mean we don't want people to come in and get tested, but that's kind of stuff, some of the things that we've been talking about is why we're not getting we're not getting any positives back at this point.
So if you feel, again, we can't say this enough, if you feel ill and you are thinking that it's possible you have this, the thing to do is to talk to your personal care physician first, to make that phone call. Or questions, you can also take them at the Bonner General Health Hotline, which is 265-3323, and they can give you advice on whether it is time to come in or give it a few more days or whatever. One thing we have heard about more and more lately are people who feel like they possibly have it and they're very sick and flu-like symptoms for a few days, and then they feel a little better, and they go to the grocery store or they go to the gas station, and then the next day they don't feel well again. If you're in that situation, you're feeling a little better, you should probably stay home and self-quarantine until you're certain you're better over a number of days.
Oh yeah, in fact, if there's kind of a diurnal type curve that we're seeing with this, is you get some symptoms, kind of vague, mild, and this is generalized, but day 1 to 3, then you feel pretty poor, febrile. Day 4, then you start feeling a little bit better, and then it hits you again 2 or 3 days later, and that seems to be when like that viral shedding is worse, when you're the most contagious. And yeah, so any symptoms, just stay home, not even just for your own sake, but you go out in the community and now you're the vector for everyone else at the grocery store.
Mm-hmm. Yeah, it's super important to stay away from that. We did mention that most of the area grocery stores have online ordering. I know Yokes does, and both Super One and Bonner's Ferry and Sandpoint, where they will do your personal shopper, they call it, do your shopping for you, then bring you the groceries right to your car. So people want to be taking advantage of that if they feel ill at all. 10 cases in Kootenai County reported yesterday. There have been 3 deaths in Idaho, all in southern Idaho, and all older men who had underlying health conditions. So that seems to be going along with what's happening across the country, as people that have experienced, the fatal symptoms of COVID-19 have been older for the most part and have had other health problems.
Yeah, but I do want to say about that, we have been seeing, especially in these hot spots like in New York City, there is a huge flux of 30 to 50-year-olds that have no medical problems that are in the ICU and ventilators. In fact, we have more in that age group than anywhere else in the world right now that are getting severe disease. And there's a huge question to why. So this is not just an old, quote, old person. I should be careful about that term on the radio. But you said that, not me. Older individuals with comorbidities, yeah, and I think that's what the term is, like we've been saying, that COVID affects them more. Yes, they're more vulnerable, but we're seeing it more in just kind of that middle age group without comorbidities, which is more terrifying, I think.
Let's talk about the fatality rate just for a moment, because people are hearing things, as they're reading things in the paper, they're seeing them on CNN or ABC News or whatever about how many deaths there are in this city and that city, the hotspots popping up. But the fatality rate, compared to the number of cases, people who are testing positive, the fatality rate is still incredibly low, isn't it?
So it's varying. I'm actually pulling something up right now. From state to state. Yeah, I think what I looked at last night, here we go. In New York, I think it was, it's not pulling up in here. Yeah, it's ranging anywhere from 1% all the way up to 6%. And so
New York
it's,
has been the highest.
yeah.
What I saw.
And I saw Colorado was up there. I think they were close to like 3.6%. Seattle was a little bit lower, but still high up in that range too. So it's this, as of this morning, as of around 9 this morning, I think we had 32,000 deaths from this. And there's some argument like, well, last year we saw 36,000 deaths from influenza. Yeah, over 365 days, not since the middle of December. And in the US, it's been, over 3 weeks? So that's why this is a lot more scary, because it's in a shorter period of time, and it's basically overrunning the areas that the hospital and the healthcare industry.
Of course, this week, we're talking to Dr. Stacey Good from Bonner General Health here on KSPT, KBFI, and it's our continued COVID-19 coverage on the local scene. Of course, here in Idaho, of course, we're on a 21-day stay-home order from the Governor Little, and I am really relieved that he brought that in as soon as because every indication leading up to that announcement has been like, it's not that big a deal. We're in Idaho, everything's cool. So it was a very intelligent decision of his. Bill Gates made a statement this morning. I don't know if you've heard this or not, Dr. Good, but Bill Gates is one of the great minds of our time. Obviously, I would trust his opinion over any politician. But anyway, he said he believes that America needs to stay home, basically shut down as a whole for the next 6 to 10 weeks to effectively kick the coronavirus. Have you heard any discussion about that in your circles, or that maybe this 2-week thing, or even April 20th is going to be premature?
It's a loaded question. So the short answer to that's no. We have not been involved with, any of the, especially within our town, like city meetings. I assume at a state level that they're getting public health and medical involvement in that. I think that, so this is my personal opinion, the 21-day or 20-day rule, everybody staying at home, the purpose of that is to try to let this peak out, and then after the peak, then it's just going to slowly decline. So until our number of cases stops growing like exponentially and or doubling on a daily basis, then this is still getting worse. My fear for us is that if you look at the map, the East Coast is getting hit really bad right now. The West Coast, actually, so take Washington out of it, or the Seattle area, even California, they're starting to see more cases, and they're starting to get the trend that New York was about a week and a half ago. They're not quite there yet. Same thing with Texas. I fear that it's going to hit us in about 3 to 4 weeks. And so now that peak's going to start going down in the East Coast and going to ramp up here. The flip side of that, now remember, I'm speaking on behalf of me, not the hospital. There is going to get to a point where we as a society need to figure out, like, how much does keeping the economy shut down to keep this disease from spreading, at what point is that balance tipping in one direction too long? Because if people aren't getting paychecks for weeks and weeks and weeks, then the long-term effects of poverty is also going to be an issue. And that's an ethical question. That's for people that are way smarter than me to decide. And quite honestly, like in my circle and my mind, my job is to take care of the people that show up in the emergency room that are sick, and let the smarter people decide that and worry about it. But I think about those things all the time, because I have some of my best friends own businesses in town, and also like work for businesses, and I need those paychecks and need them now. So it's very real, and it's something that I think about on a daily basis with this.
Yeah, it's a tough one. I'm sorry to put you in a corner with that question.
Oh, no, I'm happy to talk about it.
I was thinking, well, he's a smart guy. Maybe he knows what he's talking about. Is there anything science to back that up?
Yeah, I mean, so going back to Bill Gates, like, yes, if it is feasible to shut us down for 6 to 8 weeks, that would be exactly what we need. I just don't know practically if that's. I wish we could. I just don't know the answer to that. Yep, sure can.
The people you just mentioned that own businesses and work for businesses obviously cannot. Speaking of sciences, still, we talked about this on the show with Dr. Hurt yesterday. People around town say, God, as soon as we get through this crummy March weather here in Idaho, and we've got the warmer weather, it's going to start killing off this virus. Is there any scientific proof of that?
No, we're seeing it in South America. We're seeing it in Mexico. We're seeing it in Spain. Australia is getting hit. So, no. There was actually an article that came out last night that kept me up in an insomniac state, which I shouldn't have read going right before bed. But it was, so the Grand Princess, the cruise line that came in a couple weeks ago into San Diego, they quarantined a bunch of them. There's a big base outside of the University of Nebraska in Omaha, and that's where they quarantined a lot of these people and kept them until they basically had negative tests. And there was a group of scientists that basically swabbed their little rooms every day while they were in quarantine and swabbed toilets, swabbed under the bed where the patient didn't even touch, swabbed outside the doors in the negative pressure rooms, and found this virus on those surfaces, which is an indication that this may be airborne, not just droplet. And so that goes back to the weather issue, is just because the weather it improves and gets warmer outside, that doesn't mean that virus can't be present on surfaces. And I know a lot of people are upset. I have a 4-year-old and 2-year-old that are upset about this with the parks being closed and them putting tape around it. That's why.
Oh, absolutely. As I said the other day, last weekend it was nice weather in North Idaho. People were out riding their bikes. Went down to City Beach. It was great seeing lots of people, families out and about, enjoying the sunshine and the fresh air. Then look at the playground and kids all over the place, not staying away from each other, and they're all touching the same things. It's just like, that's just not right. So it's a great move by the city to close down those parks just for that reason there alone. It's got to be frustrating for kids to be, they just can't understand it, that they're stuck inside day after day after day. And I was thinking about it last night, because I have grandkids, as you know, doing these video chats and thinking, like my granddaughter Ellie, she's 4. That's the new reality for kids. It's like that's how I talk to my relatives. It's just on the phone. It's hard to wrap your head around that.
Yeah, my same thing with my son. He calls it the sickness, the COVID sickness, and it's hard for them. I mean, and that doesn't mean don't go outside. It just means be careful in who you're around, and don't be at a park with a bunch of other kids where you're all playing in the same, on the same equipment.
Yeah, it's only going to cheer you up to actually get outside, ride your bike.
Yep.
It's a little chilly, but get out and get some exercise when you get back home. Like I said earlier on this program, open your windows, just get some fresh air, get that musty, wintry air, stale air out of your house, and it's gonna cheer you up for sure. We read more and more, Dr. Good, about companies changing what they manufacture, trying to help out the medical industry and all of the caregivers, with masks and things like that. And a lot of people are sewing masks and sewing bags that you can put your scrubs in to wash and things of that nature. Distilleries, and just shared a story, not only a distillery, but a cannabis store nearby in Washington is now producing their own hand sanitizers. Are these, they've never done it before, you know, they've made their products, but now they're going to the hand sanitization business and basically donating it to people, which is great. Are there any health concerns with these basically homemade hand sanitizer products?
I would think so. I don't know much about it, so I can't really answer that question. In the hospital, I don't foresee us being able to use that stuff until it's past the FDA. But if it helps for at-home stuff, I don't see that there's any problem using that.
I don't mean to be trying to trip you up today. These are just questions that pop
Nope,
in my head.
no problem.
Like
Keep them coming, Bob.
I think people have been talking about is a lot of people are still ordering on Amazon. There's reports of Amazon employees being sick with this virus, and so people start talking about, well, what about my mail and my delivered packages? Your opinion on can the virus be passed on and on that way?
There's been very little evidence that it can. I don't want to say that absolutely it can't, but for the most part, actually, Dr. Gupta on CNN brought up this question the other day, and his response was exactly that we haven't had any evidence that shows that it does.
Very good. That's great information. Good thing to know. We had a caller from Bonners Ferry call in after the show yesterday asking, I know the answer to this, but are we safer being in the Bonners Ferry area because we're that much further away from Spokane than the people in the Sandpoint area?
I feel like it's about the same. Argument would be you're closer to the border, so there's a lot of cases up there. I think we're in a unique spot here in Sandpoint and in Bonners Ferry, and I wouldn't say that any one is more safe than the other.
Yeah, I think that really goes without saying. Any kind of news on possible vaccines? We talked to Dr. Hurd a little bit about that yesterday. Has anything changed in the last 24 hours or so?
Nope. There's still, and I don't know what Dr. Hurd talked about yesterday. I think even more important.
We were talking about there had been a news report came out that people who had the COVID virus and had recovered from it, that they were taking blood from, blood. They were
Yes.
donating blood, and there was a theory at least that, well, maybe because they built up this resistance that it could be used as a potential vaccine. I think it's Dr. Hurd's answer was that it's just so early in that research that we really don't know if that's true.
Yep. So what they're talking about is immunity, especially with the COVID virus. You build up, the antibodies that you're building up are going to be IgM, IgG, and IgA. And so what they're doing with patients that have recovered is they're taking their blood and they're doing it, it's so early to tell, but the plan is to do it at 30 days, 3 months, 6 months, spin that serum, see if we can get a vaccine from that. And then the other thing that can be used for is that they're trying to come up with a test to test exposure, which would be a really good thing for us as healthcare workers. So you take our blood and see if we have these specific antibodies to the coronavirus to say, yeah, we've already had it at some point, and we at least have the antibodies to fight it in the future. Now, we don't know for sure if you can't get it again, but that's also the basis of the flu vaccine, which I know is more controversial, but you get the vaccine and your body builds up the antibodies needed to fight it based on the strains that they think we're going to be exposed to most that year. And then you have the antibodies, so if you do get it, you have a much more mild case of it. So that's probably what he was referring to.
Dr. Stacey Good, we are out of time. We really appreciate you taking your time on
Hey Bob, can I say one thing before you leave? We had a 10-year-old who turned, I think she turned 10. Her name's Sophie, and it was her birthday, and she does a random act of kindness every year, and she brought the entire hospital pizzas today for her birthday. So we just have to say thank you to Sophie and happy birthday.
Yeah, absolutely. Thank you, Sophie, and have a great 10th birthday. Dr. Good, again, thanks for joining us, and we'll probably talk to you again next week.
All right, thanks, Bob.